All right, hi, my name is Laura Ritchie. I'm a registered nurse at Rush University Medical Center. I'm going to talk today about fitness and exercise, the key to wellness, on behalf of the ALF, or American Liver Foundation, and Rush. So the reason I'm talking about it is because we all know that fitness is really important. Our physicians tell us that, everyone's always emphasizing it. But I wanted to highlight the importance of fitness and the many benefits that we get. Fitness will help decrease the risk of cardiovascular disease, so heart issues. It'll reduce the risk of metabolic syndrome, which is a way of categorizing diseases like diabetes and high cholesterol and fatty liver disease, and so many others. In some cases, it's been shown to reduce the risk of cancer, so many medical benefits of fitness. Other benefits are that it improves mood and energy. It'll also strengthen muscles and bones and improve your balance. It'll help with weight control. It'll give you better sleep. And ultimately, which makes sense, that it would ultimately lead to a longer life in many instances. So we know the benefits, but to be more specific, the CDC recommends that in a week's time, you achieve about 150 minutes or 2 hours and 30 minutes each week of what they refer to as moderate intensity aerobic physical exercise, like walking or tennis. And I'll get into more specifics for that later on. Or alternatively, 75 minutes or 1 hour and 15 minutes each week of vigorous intensity aerobic physical exercise, jogging or swimming laps. Again, also give examples of that later too. Now, of course, you can mix and match. You can do a little bit of each. I'll talk more about that too. But this is just generally what is being recommended by the CDC at this time. So I wanted to talk about, now that I've emphasized those things, some examples of exercises. Now, this wasn't addressed in the earlier slides, but range of motion is a way to warm up. We're doing range of motion exercises, I should say, is a way of warming up your joints and your muscles before exercising. And it's sometimes a really good exercise just in general if you have a lot of aches and pains. Some examples are like doing head tilts. Now that would mean, say you're looking straight ahead, you turn your head to the left, then turn your head to the right, you bend your head forward, bend your head back. That's a head tilt. That helps loosen the muscles in your neck. Arm swings is what you probably imagine. You can put your arms straight out in front of you, swing it up, swing it down. Same with leg lifts. Shoulder rotation is where you would like lift your shoulder up, rotate it forward, rotate it back, and so on. Elbow lifts, ankle rotations, or wrist rotations. These are really good exercises to get your body warmed up for exercise. Now, so the CDC referenced moderate intensity exercise, and they gave us kind of a fun way of thinking about if you're achieving this moderate intensity exercise. They say that if you're able to talk, fine, but if you're not, you should not be able to sing the words to your favorite song, which I enjoy picturing that someone might try to break into songs to test if they are doing their exercise well enough, but you may or may not need to do that. So examples are walking fast, doing a water aerobics, riding a bike on level ground or with a few hills, playing doubles tennis, apparently, pushing a lawnmower. And I think it's important to note the lawnmower piece, because when we get discouraged or don't feel like we have a lot of time to get activities into our day-to-day schedule, certain chores are pretty intensive. So pushing a lawnmower throughout your lawn, that's good activity. That's something you can consider as a moderate intensity exercise. Now, high intensity exercise, or vigorous intensity as they referred to earlier, this is where you're working out so much that your heart rate is up, you're sweating, and you couldn't say a few words without having to pause for a breath. That's the way the CDC describes it. You'll see, so that's when you're jogging or running, swimming laps, riding a bike, playing singles tennis or basketball, and so on. These are just a few of the many examples. I wanted to also touch on muscle strengthening. So while the CDC did not exactly include that in their workout timeline, it's something that you want to consider for a balanced exercise or fitness regimen. It's important to do muscle strengthening. And they refer to here in this quote I placed, you want to do enough muscle strengthening activities You get to the point where it's hard to do another repetition. So repetition, you've probably heard people say when they're doing weight training or muscle strengthening, they'll say, oh, I did 10 reps of push-ups. So that means they did 10 repetitions, say, of 10 push-ups. It's a good way of thinking if you're crafting a workout schedule for yourself. You could say, I'll do 10 repetitions of 10 push-ups or something like that. So those end push-ups, to go into the next part, is an example of muscle strengthening. You can do lifting weights, working with resistance bands. So that's where you work with those stretchy bands, and you can do like a leg kick, but your leg's tied with a stretchy band to a pole. And so you're working harder to swing your leg, and that's more exercise. And again, push-ups and sit-ups, heavy gardening, and yoga. And so much could be said for yoga. I think other talks in the future will address the benefits of yoga, but yoga is a very holistic, helpful, beneficial exercise that will do a lot for muscle strengthening, core strengthening, and has a lot of psychosocial or mental health benefits. So a thing I also, all of that being said, we want to think about safety. So first, you want to make sure you warm up. So range of motion exercises and stretching are very important to prevent injury. If you're a diabetic, you want to check your blood sugar before and after, just to make sure, especially if you're making adjustments to your workout schedule or regimen, to make sure it's not too much, and you want to adjust your medication or insulin dosing as needed. If you are a person with hypertension, you'll want to do a blood pressure check maybe before and after, just to make sure you're not overdoing it. Of course, with both of those, I would say you want to talk with your doctor about appropriate exercises and making sure you have a healthy regimen. And in general, for all people, make sure you drink lots and lots of water. It's such a big deal. You don't want to get dehydrated. You want to be safe. So hydrate. You want to make sure you have adequate equipment and clothing. An example of that would be if you're doing, say you're at a gym and you're doing exercises with machines, you don't want to wear really loose, baggy clothing that could potentially get stuck in the machine or something. The next item is stretching, which I could not emphasize enough. I'm a runner, and so I've really seen the benefits and the flaws of not stretching. So it's really key to preventing injuries. So let's say you're going for a run, it's such an important thing to stretch after running. I won't today go into all the stretches that are good to do, but I would recommend, if you want to know more about that, Googling that or looking online about good stretches to make sure you're protecting yourself after an activity. And stretching before is important too, but if you do a vigorous activity, it's very important to stretch after. And all that being said, it's also important to rest, especially if you're trying to work hard and do new things. Take breaks. You will get tired, and you don't want to hurt yourself while you're working so hard. And another important item is that if something starts to hurt, make sure you do stop. There's a difference between the burn, so to speak, of exercising, where you're pushing yourself and you feel yourself, making your muscles work. But it's different when you feel pain. If you feel pain, that's not normal. You shouldn't do more of that. It's your body telling you that's too much. You should stop that activity. Some general tips that I wanted to give you all is a strong core is a really important thing to think about for everyone in every walk of life, whatever you're able to do. That's going to be a game changer for your experience with exercise, in my opinion, in my experience, and as data shows. So that's why I pointed out earlier that yoga is really great, but doing exercises to really strengthen your back and your abdomen are going to really set you up for success and prevent injury going forward with other exercises. Again, as a runner, because that's my main experience, I found that when I worked my core out more, I had it was so much easier, and I felt stronger, and I actually was much less prone to injuries when I had a stronger core. Another thing is that you want to alternate workout emphasis each day. So you may have heard people say things like leg day. What they're saying is that they are alternating the emphasis of their workout that day. And they do that to allow the thing that they worked out yesterday to rest and recover and rebuild. So say you go to the gym, you do leg exercises, and then your legs are really tired. The next day you you should alternate. You should go work on your upper body then. You should let your legs rest and recover and work on something else. You don't want to over fatigue that part of your body that they're working. And it's important to be balanced. So I just want to emphasize that. Again, stretching is so important. Please stretch. And then keep trying new things. I think that people often get very discouraged when they're trying to work on fitness and exercise. So, don't lose hope. Keep trying to find the thing that's fun for you to do, that's enjoyable. If you haven't found it yet, keep looking. There are so many options. So don't feel like you're stuck on doing something you hate. I know a lot of people who tell me, oh, I hate running and I don't know what to do and I don't want to have to run. And you don't have to run. You could go swimming, you could play tennis, you can do so many other things. So just keep looking for the thing that fits you. And that being said, I want to talk about barriers to fitness. As a nurse who works with, I've worked with patients inpatient, in the hospital and out, working with people who know that they need to work on their fitness but are really just struggling. Yeah, I want to just try to address some of the things I've heard about and the major concerns. I put this little picture in here just to, I think, just exemplify that inner dialogue I know we all have, that it's hard to want to work out. Even if you like the thing you do, it's hard to know that you're going to do the thing that's really tiring. So, but don't give up. Keep trying. Yes, you should go to a gym if you can do it. So I want to talk about motivation. Some ideas to help keep exercise in your life. You can set reminders. You can find a friend or a buddy to help keep you accountable. So just even saying, I sometimes will do that. I'll say to someone like, I'm going to the gym today. And I say it so I make it real. So I have to go. And, if I speak it, then I'm more likely to do it. Additionally, physically scheduling it into your day, putting it in your phone, putting it in your planner, it's more likely to get done if you do that. I also put on here, I think it's because I think it falls in the motivation issue barrier, or it's a barrier of motivation. We feel self-conscious sometimes. I know so many people, including myself, where you don't want to go to the gym because you feel silly because there's all these really intense people working out and you just feel self-conscious about not being as intense as them. And I would say find the things that you find fun, so you can just not think about those people, or find an activity that you just get really into, or just start with doing things at home and get comfortable there and work yourself up to challenging that self-consciousness and still going to the gym despite those worries. You'll feel so much better for it. And all of this is to help you feel more confident in yourself too. So I would say start small, find the things you like, work out at home if that's a good way to propel yourself into the next step. But keep trying, keep pushing at that. Another barrier is time. People are really busy, they're working really hard, they work out long hours at work, and have families and kids and things. So some ideas I had for that, if you have a smartphone, there are apps that are called the 7-minute workout apps. The CDC mentions that even small little broken up workouts do make a difference. So it's okay. If you try these apps, they're helpful. They'll direct your exercises. They'll tell you with things that are in your home how to do a workout. I have one, and it says, it has you do things like wall sits, push-ups, crunches, and it's hard. I feel sore after I do it. It's good. So that's something to consider. There are all kinds of versions of the apps. You can find the one that works for you. And there are other things like that that can help you get a small workout in before your day starts or before it ends. A thing that I have always found to be a good one is you could park far away from the places you have to go. So if you go to the grocery store, park at the back of the parking lot and walk in. And if you're working out at home, things you can do is yoga. You can do yoga. There's online free yoga sessions you can use. Push-ups, arm dips, where you put you say you're sitting on a chair, you scoot forward, so you're off the chair, just your arms are supporting you, and you just dip carefully from there. Lunges, which I did not spell right, that's not lungs, lunges, and squats. You can do things like walking your dog. There's so many more examples that I didn't put here, but there's so many exercises you can do at home. Physical limitations. So this is another one I hear a lot about, especially because I'm a nurse, is injuries and disabilities can discourage us from thinking we can be active. People who are often limited severely feel like there's no way for them to be fit or exercise. And I wanted to address that. But first, I would like to say that you should talk with your doctor about safe exercises depending on your disability or injury. And set small, frequent goals, I would say, just to keep it small at the beginning and work your way up. So what if you have joint pain? I went on the Mayo Clinic website and they had some nice recommendations for how to work around joint pain. You'll want to make sure you keep impact low. Now, examples for that would be those elliptical trainers. Those are at a lot of gyms. They are very easy on the joints. And then water exercises are great. You can go for swims or do a water aerobics class. If you do have a lot of joint pain, you want to apply heat. You can use warm towels, hot packs, shower, and they recommended about 20 minutes of that. You want to move gently. So just like I said, you can do range of motion exercises 5 to 10 minutes before you start doing other things. And you want to go slowly. You don't need to jump right into something really intense. And if you have pain, you might want to slow down or stop. And also you can ice afterwards. Another 20 minutes, it'll help with reduce the swelling. What if you're chair bound? What if you can't get up? Some things you can do in your chair that we talk about is you can hold out your arms and you can keep them there for as long as you're able. Challenge yourself, time yourself, see how long you can do it. You can do those arm dips potentially. If say you're sitting in a chair, you don't have to get off of it. You can just push up right from the chair and see how you feel. And do that maybe 10 repetitions of 10 arm dips. See if you can do more. And same with leg lifts. This is a thing that my family will sometimes challenge each other to do, like if you're on an airplane. You can hold your feet up. You can either keep your knees bent and lift your feet up off the ground. You'll feel that in your abs. Hold them there for as long as you can, or just set a limit of 30 seconds and see if how that feels. Another thing is you can hold your feet out straight in front of you and lift them up, little pulses up in front of you. That's another way to do exercises. A way to think about motivating yourself in this context too is, say you watch a TV show. You could try to challenge yourself to do this every 5 minutes throughout the TV show or some things like that. Just setting goals based on the TV show could be a helpful thing. And what if you're bedbound? There are some examples I found beyond just what I was referencing there. You can do the arm lifts and leg lifts if you're able to do that. You can do the palm stretch where you literally just stretch out your palms, squeeze them in. And then this ankle plantar dorsiflexion exercises where you stretch your toes out and rotate them. It's like a range of motion exercise in a lot of ways. Just stretching, pointing, lifting your ankles and do it as long as you're not feeling pain. It's a good one to do. And in summary, this is a very brief overview of an abundant subject, a subject abundant with recommendations and ideas. So don't give up. It's such an important part of everyone's life to be fit and active, and the benefits are so far-reaching. So don't be discouraged. You can do it, even if you slip up or miss some days or weeks. Even just keep going. It's okay. We're all in the same boat. We're in different parts of the boat, or we're all trying. So you'll get tired some days, but just keep working at it. It's so helpful, and keep looking for activities you like. So I hope this helps, and don't hesitate to reach out to your doctor or friends and family just to think of ideas on what will work for you. Thank you. Okay, I'm done.